Okay, so for my term project, I've decided that I would like to write an essay outlining the ways in which crowdsourcing can be useful within public health domains. So ultimately, my paper will be emphasizing on the ways that crowdsourcing is and can be incorporated within the different healthcare systems in order to promote the testing and treatment of disease. Also, I plan on outlining both pros and cons and what can be changed in order to make these kinds of information sourcing a lot better. So given the current situation, I'd like the bulk of my research to be primarily focused around COVID-19 and the use of crowdsourcing in managing its spread. So using the COVID Alert app as my central focus, my research will be aimed at unveiling the ways in which this means of crowdsourcing is helpful in managing the spread of the disease. So I plan on doing this by emphasizing on the social and technical threats surrounding this type of information sourcing that can affect the app's ability of accurately and efficiently tracking areas that have potentially been exposed to COVID. Okay. So ultimately, what the COVID Alert app is, it's a federal alert app that notifies users of possible exposures. The app was originally launched in late July with aims at basically slowing the spread of the disease by delivering exposure notifications to all of its users who were in extent close contact with an infected person over the past 14 days. So it basically allows for people to track their symptoms, test dates, and test results. And as of right now, all Canadian provinces have activated the app apart from Alberta and BC. Okay, so here's a screenshot of what the app itself looks like. So it claims to be completely confidential and essentially works via Bluetooth. The app uses Bluetooth to exchange random codes with nearby phones. So basically, if you test positive for COVID-19, you can upload a one-time key code given to you from your healthcare provider, and then the app will notify people who you've interacted with that they've also been exposed to someone that has the virus without revealing your identity. So the app constantly works in the background of your smartphone as long as you have Bluetooth and/or internet connection. And then, like I've mentioned, the goal of this app is to notify its users of potential exposure of cases from the start date of a user's symptoms all the way to their test date. Okay, so with that being said, the goal of my project will be to highlight social and technical threats surrounding this type of information sourcing. And I plan on doing this by outlining both the pros and the cons of crowdsourcing within different healthcare domains. So off the bat, here are some common questions that I found surrounding the usefulness of the app through news articles, interviews, as well as research studies. Essentially, people want to know whether the information on the app is accurate, if it's trustable, and basically if it's actually working. So with crowdsourcing, as I'm sure you guys all know, there's often a lot of issues surrounding reliability and whether the information being sourced is accurate and up to date, which is clearly an issue in this case as well. So there's a lot of ways that we can test for whether the information is accurate and if this kind of sourcing is actually working. So for example, in the graph that I have here, it displays COVID-related deaths within the past few months. So we can see that since the launch of the app in July, cases and deaths have actually risen again significantly these past few months, as opposed to going down, which was the original plan. So the whole point of the app was to help stop the spread. So information from the graphs like this basically suggests that something may be off or not being used properly or efficiently. It's letting cases rise again, or simply that the app itself just isn't effective. So here's another example of a lot of popular news article headlines that also seem to point out some flaws of the app. Here you can see that in relation to the number of users and cases in Canada, the amount of cases being reported on the app are definitely inaccurate. This also suggests that people aren't making it a priority to report their cases. This is another issue with crowdsourcing because there isn't really any underlying motivation to reporting. It's done on a voluntarily basis, so people seem to only use it as much when they want to and not as much as the government has hoped for, clearly. Okay, so in terms of existing information on the use of crowdsourcing within healthcare domains, most research that I have found was focused on psychological and biological medicine-based research. So first, in the realm of psychology, the same type of information gathering is often used to report symptoms following psychological experiments. So reports on feelings, mental health, and cognition. In psychology, they use crowdsourcing to help map how people from different cultures may cause variance in results when it comes to different psychological studies. With that being said, some pros of this include it being really cost effective. It allows researchers to draw from large pools of populations through internet reporting. So an example of this that I found in a lot of my research articles and a lot of different kind of articles basically talking about crowdsourcing in healthcare system this app called the Great Brain Experiment. So basically the app was developed by scientists at the University of College London, and it lets people anonymously play these games that you see on the screen that test for cognition and help contribute to research surrounding the human brain. So this app in particular collects information about how we understand how we make decisions and what determines our happiness through crowdsourcing information as well. So you basically play these games, and the app gathers information as to how you play them, what decisions you make, to further continue studies based off of brain research. Okay, and then in medical studies, crowdsourcing is also used when screening for potential drug candidates. It uses platforms like Amazon to recruit study participants, and it allows medical professionals from around the world to share insight and collectively come up with treatment plans. So pros for this is that there's more medical opinions and different opinions from across the world, and all sharing information on one specific platform. So here's an example of that. Basically, when these medical professionals promote messages through different platforms, a bunch of people respond and create messages. So this is both experts and non-experts. And then exceptional messages are recognized and shared. Here's another example with surgery. So one surgeon uploads a surgical technique through the internet to submit to some kind of a judging platform. Experts and non-experts review it, and then feedback is given back to the original surgeon. Okay, so lastly, two of the most important limitations of crowdsourcing in this field that I want to stress in my project are the extent to which information is credible. You're dealing with people's health in this case, and in some cases it can be life or death situations. So it's really important to find a way to assure that all the information is credible and up to date. Also, another big point to remember is that not everyone will have access. With COVID being such a big deal right now and very much an emergency situation, it's important to note that only people with access to their own smartphones and access to internet will be able to benefit from the app. This leaves many homeless people, poor people, and overall financially disadvantaged families from participating. Finally, in relation to the app, seeing that it's still relatively new, another limitation I'm finding with my research is that there's not too many research articles on it yet, and the few that exist aren't in line with what I'm focusing on. Also, with the whole pandemic and lockdown restrictions, it'll be a little hard to conduct my own research on how we can make that more effective. But for the most part, like I've already discussed today, I have my pros, my cons, and related research and limitations of the COVID Alert app ready to go. Just have to figure out exactly how I'm gonna manage to find information how to make the app better, and through my own research and through things that I can do, I guess, from home to do that. Okay, thank you. Bye.